Of course, the conversation surrounding abortion is a hot button issue. I think that might be an understatement if there ever was one. For some, it is a very difficult decision, both for planned and unplanned pregnancies. It's raising some concerns about mental health, given all the stress going on in the country right now. So for more on this, we want to bring in the Chief Medical Officer of Planned Parenthood of Southwest and Central Florida, Dr. Sujatha Prabhakaran. Doctor, of course, abortion is still legal. We don't want to put the cart before the horse here. There is this possibility Roe versus Wade will be overturned in the future. Pregnancy can be stressful enough, but with all this going on, what are some of the concerns about mental health for people who might be grappling with an unwanted pregnancy?
Thanks, Trevor. And that's a great question. And I do, the first I want to say, as you said, abortion is still legal in this country and it is still accessible. So, I'm already seeing patients who are confused by this leak and by the information that's being shared. Just this week I had a patient who thanked us for being here and said, I thought I couldn't even get abortion care. So I just want to clarify that for folks who are listening, that the care is still available right now. And when I hear about potential restrictions on access to care, it makes me very concerned about the mental health of patients who might need abortion care. We already see, even though abortion is legal, it's very difficult to access in many states. And we see every day patients who struggle to find childcare, to find transportation, just to get the care as it stands.
Doctor, even trying to set aside the controversy of abortion and however people feel about it, I would like to just look at this from a place of empathy for a person who is in the midst of an unplanned pregnancy and is trying to decide the best course of action for them and for their baby. In some states, like yours in Florida, individuals who are considering abortion, they have to seek some kind of advice or some kind of counseling, and then they have to wait a certain period of time. You've seen these patients face to face. You've talked with them during those stretches. What's the impact? What is the wait? What are some of the things that they are dealing with in these periods?
Sure. I think for patients who are now having to have it's basically a 2-visit mandate when care could be very safely provided with a single visit. So for our patients, these are very well considered, thoughtful decisions. They're difficult decisions for our patients, and then adding an extra visit means that for many of our patients, they have to find childcare. They have to find transportation. They have to take an extra day or time off work. And so all of, adding these barriers just adds to the stress and anxiety that our patients feel already in this difficult time.
We made it clear abortion is still legal, but we've seen a number of states that have placed these restrictions very early on, sometimes as early as 6 weeks, which critics of these laws especially have pointed out a lot of women don't even know they're pregnant in that time. I am curious, from your perspective, dealing with these people who are pregnant right there, about how far along typically are they when they even come into your office to begin considering their options?
Sure. So most abortions in the country happen in the first trimester. So that's before 14 weeks of pregnancy. But, it is often difficult for patients to know that they are pregnant before, for example, 6 weeks, like the Texas ban. For many women and people with uteruses, their periods are irregular, they have busy lives, it's hard to keep track. And by the time they realize that they are pregnant, they're often beyond 6 weeks. So, these barriers are already affecting, real patients. We're based in Florida, but every week we're seeing patients who come to us from Texas because it's difficult already to access care in Texas and then the surrounding states. So they're coming to Florida all the way from Texas in order to access care already.
Dr. Sujatha Prabhakaran, we appreciate you taking your time to share your perspective with us today. Thank you for joining us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.